Have you noticed a small bump at the base of your neck? Some call it a widow's hump, but what actually causes it? And can it be reversed? In this video, I'm breaking it down. The anatomy, the habits that cause it, and the exercises that can literally reshape your posture. This is Dr. Cece. Let's dive in. So, what actually is widow's hump? Well, the real name for this condition is Dowager's hump or hyperkyphosis. The street name is widow's hump because it was historically associated with dignified elderly widows whose posture had deteriorated with age and sorrow, leading to this hunched over appearance. While the name links it to older widows, a dowager's hump is actually a very common spinal issue affecting all genders and all ages. Primarily, it comes from poor posture, and it can be treated with posture correction, with exercises, and by addressing the underlying causes like osteoporosis, for example. Now, this is a forward flexed posture pattern where the vertebra at C7 through T1 and T2 sometimes becomes rounded. The hump or bump can be a structural kyphosis, a long-term curvature. It could be fatty tissue accumulation from poor posture, or it can be muscular imbalance with a tight chest and weak, deep neck flexor combo. It could come from compensation for anterior head carriage. That's forward head carriage, aka text neck or aka tech neck. This is not just a fat pad. It's your entire upper spine adapting to the posture you spend most of your days in. Some of you may be familiar with the actress Alexis Bledel. She is the actress that played Rory on the hit show Gilmore Girls. There has been some controversy and speculation about her posture. As you can see from these photos, she seems to have a slumped over posture with a rounded upper back. It appears to be hyperkyphotic, much like dowagers, and that's been attributed to playing a character for years that often hunched over books or backpacks, affecting her real life posture. I bring this up because I really want to stress the point that the position you spend most of your days in really does affect your spine. Here are the top common causes of a dowager's hump. Forward head posture, tech neck, like we discussed. Every inch your head moves forward adds about 10 pounds of strain to your neck and your shoulders. Now, I've already done a deep dive into tech neck and forward head posture with great exercises and great tips. That's located in the playlist if you're interested in exploring tech neck on a deeper level. Number 2, weak, deep neck flexors, the tiny stabilizing muscles that keep your head over your shoulders. 3, tight upper traps and levator scapula. They pull the neck backward and upward, exaggerating the curve. 4. Rounded shoulders and tight pec minors. 5. Just bad posture. Long hours sitting or looking down. Again, not just tech neck, but, text neck, computer neck, all of those things. And they come from phones, laptops, driving. I guess I can call it driving neck. It could be from dental or healthcare work, where you're always crammed over looking down. Again, just posture. Number 6, changes in bone density. Think osteoporosis, which usually happens in older adults and can exaggerate structural curves. Or number 6, it could be caused by certain medications or hormonal issues. Not sure if you've got it? Here are some symptoms to look out for. Neck stiffness, headaches, shoulder tightness, compensatory low back or mid-back pain, difficulty keeping a good posture. And here is the huge telltale sign, the elephant in every room. A visible hump at the base of your neck and a characteristic hunched over posture. The question you're probably asking yourself right now is, can this be fixed? And the short answer is yes. If the cause is muscular or postural. If it's structural, we can improve it, but not fully reverse it. Either way, you can dramatically change how it looks and feels. So here's the fix in 3 simple steps. Step 1, awareness and setup. We're going to reset that posture. Lift the phone, not your head. Screens should meet your eyes, not the other way around. Some tips: bring your phone to eye level. Chin slightly tucked. Ribs stacked over pelvis. Shoulders gently back and down. Think chest up, chin back, tall neck. Step 2, let's do some mobility stretches to undo the tightness. First, we'll do an upper trap stretch. This is a great technique to increase flexibility and reduce tension in the upper trapezius muscle, located in the neck and upper back. This stretch involves laterally flexing or tilting the head to one side while stabilizing the opposite shoulders. It can be done standing or sitting down. You're going to do about 20 to 30 seconds on each side, a few times a day. Next are chin glides. These are my favorite, and I teach them to all my patients with neck pain. They are simple yet effective exercises to improve posture, alleviate neck pain, and strengthen those deep neck flexor muscles. Think double chin, but cute. Okay, so go slow and gently glide your chin straight back as if you're trying to create a double chin. The movement should be a small, subtle horizontal slide of your head backward over your body, not a downward tilt of the chin toward the chest. Remember to keep your back straight. Hold this position for 5 to 10 seconds, feeling a gentle contraction at the base of your head. Then you slowly return your head to the starting position. Repeat this movement for 5 to 10 reps several times a day. Last are thoracic extensions over a foam roller. This is a good way to improve posture and upper back mobility. Lie on your back with your foam roller placed horizontally beneath your upper to mid back. Clasp your hands behind your head for support and gently arch backward over the roller. Keep your hips on the floor. A word of caution: do not foam roll your lower back, your lumbar area. This area is very sensitive and does not like the roller. So, stick to your upper and middle back. Don't go below the ribs. Step 3. Now let's strengthen for a long-term fix. W retractions. I really like these. This exercise strengthens the muscles between your shoulder blades. You can do this either seated or standing. Position your arms out to your side with elbows bent and at a 90-degree angle, forming a W shape with your body. Breathe out as you gently squeeze your shoulder blades together towards the spine. The movement should come from your shoulder blade muscles, not by arching your lower back or shrugging your shoulders. Imagine you're trying to hold a pencil between your shoulder blades. Squeeze that mid-back and open the chest. Repeat for 2 to 3 sets of 10 to 12 reps. We're going to finish up step 3 with 2 easy ones. First, wall angels. Perfect for posture endurance. Just like the snow angels that you used to do when you were a child, except you're only going to be using your arms and you're doing it against a wall. Go slow with this one with controlled movements. Last, we're going to finish up with chin tucks against a wall. Your neck will really love this. Just like the chin glides we did in step 1, but just against a wall. If you're walking around with a widow's hump, you don't have to look and feel that way. Not to that degree. You can dramatically change things with posture correction, with exercises and stretching, and by addressing any underlying causes. Consistency beats intensity. It's the things you do every day that will reform this curve. Hit the like button and subscribe to the channel for more posture perfect videos. And drop a comment telling me which posture topic you want to hear next. This is Dr. CC. See you next video.